Now let me see UB66 called as a Sutungku. Sutungu. Anterior and inferior to the fifth metatarsophalangeal point to be known as a UB66 point. This point to be known as a Sutungku. Sutungku. Right. So this point is exactly, so this entire region, UB meridian, the entire pathway having the points. But let me see practical as well. But once we activate that specific point, remember, I told you 67 points. Among them 67 points, you wanted to activate only one point to treat for all the 67 points. The choice is yours, but you can use the one point, that point to be known as a Sutungu. Since this belongs to the horary point, the horary point, or the in-house point, or that command point itself, without bothering to anyone, without disturbing to any organ, this point to be activated, that point to be known as a UB66. But most of the times, whenever patient feels some kind of the back pain, I told you when the urinary bladder having the deficiency, according to the pulse diagnosis, you can have a look. Low energy is there on the UB meridian. Only one point you just activate, but that having the great impact to treat for the numerous diseases of the urinary bladder related, because this called as the para-orb of the uterus. The urinary bladder, the name is one particular organ, but where is the ovaries are existing, where the fallopian tubes are existing, where the uterus is existing, where the endometrium is existing, right? Where is all the pelvic organs are existing and to be taken place on the urinary bladder. That's the reason this organ to be known as a para-orb of the uterus or the para-orb of the pelvic organs. So therefore, once you activate UB66 point, but that all the indication, if the goodness of the patient, maybe Almighty wanted to treat that particular patient, but numerous diseases they do have, but still one particular specific point is enough to regulate the urinary bladder meridian. So Almighty will change their health, illness to the healthness. But of course, the patient will be fruitful once we activate UB66 point. Now coming to the last point, but not definitely least, but more than that, this is the most imperative point, 67 point, where the nail matrix is there, point 1 shown proximal to the lateral corner of the nail base of the great, that is pinky toe or the small toe, or the nail matrix of the fifth toe. This point is located. But however, you all know where this point is located, but generally this point is amazing point to treat for the known and unknown cases of the urinary bladder related disorders. However, what I told you on the UB66 is the tonification point, but by the way, UB67 point also tonification point to treat for all the vesicle related disorders. So once we activate this specific point, since this point belongs to the mother point, that's the reason activation to be done. So UB67, how to tonify, how to sedate this point, we'll try to see that in the practical. But hopefully UB67 is the mother point. UB67 is equivalent to the one specific point, that point to be known as a Argyan. Argyan means two Argyan is there. Here Argyan, second one is Li2. Shangyang, Argyan, Sanjian, Hoku, Yang, Si, Pian, Li, Wen, Leo, Shanglian, Cho, Chi. These are the Li1 to Li10, 12 points. But these are the points, is Li2 points is Argyan point, Li2 is the good point which is connecting. Even I remembered now, even I have taken the Li2 point, that time also I told you, Dr. Siddiq Jamal and Fazlur Rahman has written in their journal that to be known as a Li2 is good point to treat for all the white discharge or the leukorrhea related disorders, especially for the women, he said. But at the same time, Li2 is equivalent to the which point? UB67 point. So therefore, UB67 point is the great point to treat for the all the female related disorders, right? Pelvic related disorders, back related disorders, occipital related disorders. Because UB61 to UB67 points, remember that points are treating for the occipital nerve. Those points are treating for the occipital nerve, the great occipital nerve, lesser occipital nerve, visual cortex of the brain. Where is the visual cortex? This is the visual cortex of the brain, can be treatable by using the UB66 to the UB67 points can be treatable. However, UB67 is the mother point to strengthen the urinary bladder. You remember the chingming sanso, meeching chuchai, wucho, chengwang, locho, tongtian, tianso. UB1 to UB10 point, where it starts? It starts from here. It starts from here, UB1. So UB1 point is the beginning point, UB67 is the ending point. So therefore ending point is treatable for the beginning point is treatable for the UB67 as well. So therefore UB67 is the last point but treating for the beginning point as well, because it is originated from one particular nerve, that nerve to be known as the ophthalmic nerve. So ophthalmic nerve to be activated by using this particular point on the UB1, but at the same time UB67 also indirectly connecting to the visual cortex of the brain. UB60 to the UB67, all the points, 7 points can be treatable for the visual cortex of the brain. Especially there is the ventral side, there is a visual cortex, one region is there. On the posterior side of the visual cortex of the brain is there. So that point to be activated. Still you wanted to use one local point, you wanted to treat, use the Tian Su. Tian means is the heaven Su point is located on the scalp region. That point is UB10 point, UB67, UB10 point. Both the points are good point to treat for the vision related disorders as well, occipital headache as well. By the way, but normally the whole world, the people greater than 160 countries are practicing acupuncture. In that particular region, the people who are using the acupuncture, they were recognized that UB67 point is treatable for the breech baby presentation as well, the malposition of the fetus as well. The fetus is the upward direction face is there, but still in the 8th month the face is not turned to the downwards direction. Try to find out on the 8th month or the 3rd trimester, when after the 8th month, the half of the 8th month gets completed, then still the baby is infant is inside the mother's womb. That means upward direction is there, the face is not descended to the downwards direction. That time it is advisable to use that point UB67 continuously. It is advisable to use the needle sensation, otherwise it is advisable to use as a moxibustion is really good. At least 2 to 3 moxa to be given on that specific point for the span of minimum 20 to 30 minutes is advisable. To activate bilaterally or the unilaterally is advisable, so that the labor pain, and also it produces one hormone to be known as a oxytocin hormone get releases. That oxytocin is released by that hormone also called as a love hormone. So that will be releases by activating that specific point. So therefore the breech baby presentation, if ultrasound scanning is very much mandatory. Remember again, when the patient is telling that yes, I wanted to become the normal delivery, so acupuncture has been given for the span of last 1 month, then again it is the cesarean section to be taken place. So that means the umbilical cord encircles to the head region of the fetus. So that time will be complication, but that time don't take the chance that acupuncture will does the normal delivery. That's the reason when at the 8th month, if possible, we can do the ultrasound scanning if at all necessarily required. Otherwise the movements are good and the baby is on the downwards direction, then definitely you can use this point to become the normal delivery. If the baby is only on the downwards direction is there, but still the patient, that labor pain shouldn't get more pain, to induce the natural normal delivery without much contraction, without much pain of the uterine muscles. So that time you can use this point, but definitely patient will be helpful. But all the gynecologists here, I wanted to tell you, because around 50 years ago, but no one has been going for the cesarean section, but of late you know that the most of the women also very temptation to do the cesarean section because their muscles to become the healthy of that muscles, that's the reason, or something else. But most of the times women also is not advisable to go for the cesarean, but since it is natural phenomena God created for the for us to bring the baby naturally, is not the operation is required, but all the gynecological intention is the purified intention is there. They don't want to go for the cesarean section. Even the patient on that specific moment, on that specific 1 hour, half an hour, 2 hours or 3 hours, or the maximum they can wait for the half day, but certainly the normal delivery to be taken place if they also apply the needling sensation on the UB67 point and also Li4 Heku. Then you just activate Li4 is the strong manipulation. Also you wanted to add up the another couple of the points like a Sun in Chio, that is UBS spleen 6 point, Li4 point, UB67 bilaterally. You can give the strong stimulation, the galvanic current you can apply to that particular region. Patient definitely having the great impact. They'll get the more contraction. The patient, it takes 6 hours to get the delivery. Chances are there within 1 hour, 2 hours, he will get the delivery, and with that good contractions and without much pain. Pain is there always, but however the pain can be minimized by using this specific point. Thank you. I'll wind up now. Please